Hey, Curley.
Curley, would you like to stand up?
Yeah, so Curley,
You can really come forward.
if you don't mind, Curley, maybe you could just spend 2 minutes talking, or 3, about a bit about your experience. And what I can say about this fine gentleman is that he's taking on a massive role in the department. He's taking on basically oversight of all of our clinical operations, which is something that hasn't really been in place before. That includes all of our emergency outreach, all of our outpatient, all of our inpatient and residential and urgent care services, as well as all of our prevention activities. And Curley will tell you a little bit about himself. I embarrass him because I use such accolades when I introduce him.
Thanks, John, and thanks to the commission for inviting him to have us come. I'm starting out in my role as Chief Deputy Director, but really, even though this is a appointed position, the way I view it is that I serve at the will of the people. As much as I have a lot of credentials as a physician, as an educator, as an academician, one thing that I think is really important, and I told the commission executive team this, something that informs my work very deeply, is that I started out in psychiatry seeing a family member who had a serious mental illness go through a lot of struggles and get better. And fortunately, she's doing well, has raised a family. But I think the way I approach this work is that I feel that anybody that I encounter in our system needs to get the same type of careful, dedicated care that she got. And so I'm here mainly to make sure that the things that people do in Beverly Hills, thanks. The same thing that someone does in their private office in Beverly Hills, if someone's on the streets of downtown LA and doesn't have a place to live, then they should get that same type of treatment. The same access to medications, evidence-based practices, to make sure that our clinical system is really tightly addressing all of the gaps. So as I've started now, this is my 4th week, I've been hearing a lot, and it's good to come here to hear some of the concerns and the issues and some of the problems that I look forward to in my time in this role to fixing with you all. So I'm always open ears, open eyes, but I also feel like my work won't be done until things are better than when I came to this position. Just to give you a very, very brief thumbnail, I did work at UCLA for about 10 years as a director of the consultation and evaluation service doing medical psychiatry. And then I went over to Martin Luther King Drew Medical Center during the time that it was going through a lot of troubles. We managed to keep the residency program afloat until the hospital closed. The very good news is that partnering with the Department of Mental Health, the residency program will be coming back in a few months. So for those of you who've been in underserved areas like Service Area 6, the emphasis of this program is really to treat those who are in the public sector. We're not training psychiatrists to go out into private practice. One of the requirements for our interviews were to make sure that they can address the needs of the family members of the constituents of the people in this room. I'll stop there and just say that I'm glad to be back. It's a reincarnation for me, and I've had some less sleepless nights than I was expecting, but it's been an exciting job, and I'm looking forward to working with our new director to make things happen.
Yes, I'm just writing notes on myself. Next, I'd like to invite Sanderson, Dr. Sanderson up. As you all know, one of the things that I've been focused on in the department is getting in place professional leads. We call them discipline chiefs, who are subject matter experts and know their field extremely well, to advocate for their discipline, to get teams working together at a new level, to bring in the right staff from all over LA and the country to deliver care, and really to advocate on behalf of the trenches, which includes the providers and the folks that we serve. And Luann has a lot of experience in this role. So Luann, welcome, and maybe you could say a few words.
Thank you, John, and thank you everyone for having me here today. It's really nice to recognize a few of the faces in the room, back here and up in the front as well. And it's nice to see the friendliness that's here and the warmth. Welcome. So, I guess I've been in a couple of different places where I see some faces repeatedly, and that's nice too. But as far as what I came to DLH to help do, first and foremost, let me tell you that I've known Dr. Sherin for a few years. He was a psychiatrist on the inpatient unit at the VA where I used to work here in West LA. So that goes back probably 10 years or so, maybe longer than that, I can't remember for sure. I have a lot of trust in his leadership. I have a lot of first-hand experience with his work and his caring of patients. I know that he's a person of honor, and I'm proud to be on his team. And I'm really happy to be here with all of you. So I also had a short 4 weeks with Dr. Bonds, and getting to know so many people at DMH. This is my 8th week, so I'm a real veteran now. But let me share too my background. Let's see, I've been in mental health nursing for over 20 years, which makes me feel a little bit senior, and that's okay. I've done frontline work, inpatient. I've done private practice outpatient. I've done mental health clinic work in another state. I've done work with the geriatric population. I've been an educator in a professional nursing program in the Midwest. So I know what I expect of the nurses coming on board. I know what to look for. I know what to listen for. And I know what to watch for. And I feel pretty confident in saying that I think our leadership team is getting tightly knit. Would you agree? Yeah. So let's see, I've done a little bit of research as well, things that would help recognize the aging population and spiritual perspectives that are held by individuals who suffer with depression. And my doctoral study, the research part was about civility in the workplace. So I intend to enhance the workplace. I expect to retain the quality staff that we have and to attract more quality staff. And we're asking for more people to meet your needs at the front line. Okay? So my ears are open too. And I think people are finding their way to get to my phone number somehow. And I'm always happy to see you face to face too. And some of your reps already know me. So thank you.
What's your role in the organization? What's your role going to be in the organization?
Oh, I'm sorry. I'm the chief nurse. I am the first on board for the Office of the Discipline Chiefs.
Yeah.
I'll also have a role as a provider